As we all know, over the last few years, or actually many years, there have been a number of barriers that have been identified, basically factors that we think stop the ethnic minority groups from availing the breast cancer screening services that we have. Lack of knowledge, lack of communication, dependence on younger members of the family to travel to the screening unit, or depending on the younger members of the family to communicate once they are in the unit, are all factors that we are aware of. Also the fear of a diagnosis of cancer, or the fear of the treatment for cancer, or the possibility of disfigurement of the breast or the body are all known factors. Well, some of these points obviously may be barriers to everybody, and I'm sure we do see in pockets of the majority population as well. And as we all know, socio-economically deprived areas always have a lower uptake when it comes to screening programs. So in the ethnic minority groups, there is probably communication issues, and the main issue being the language barrier, whether it's reading and writing or whether it's communicating once they're in the unit. But I felt during my interaction with the local community, where we put in place a dedicated direct health promotion program for the women from a particular GP surgery in the Avon breast screening unit catchment area, that the women had real hunger for knowledge. They wanted to know. It's not as if they wanted to seclude themselves. They really wanted to know. They sometimes didn't know where to go for information, and they sometimes didn't know how to use the information they got. But overall, I think they are keen to avail all facilities that we provide them.